Hello, hello, hello. Happy Tuesday. Happy Tuesday, ATHLers. Welcome to my Tuesday show. My name is Abby Tyler. I am your host, practicing family nurse practitioner, content creator, and community health volunteer. Good evening to all of you. Today is Tuesday, and I'm going to be concluding on our show. Let's talk about sex. Okay, so invite your friends, invite others, come on in. It's going to be an exciting show. Hope you guys watched the show that I did last week. If you haven't, I'm going to try to repost it underneath in the comment section later on. But for you who are members of followers of Abby Tyler's Healthy Living and Abby Tyler's Healthy Living page, the video is like two videos down below this one. And like I said, I'm just going to post underneath the comment section there so you guys can watch it and review. So here I am. First, as always, I'm going to give my disclaimer. Whatever I say here should not take the place of you finding you contact your own personal provider for any kind of changes. So do not make any changes to your regimen before you know making you talking to them. So here we are. I'm going to go in here. Of course, I'm going to give me 2 seconds here. It's pouring, raining. Oh, it stopped a little bit and it was ungodly hot today. So let me go in here and I just have to share this. So here we go. And it's just gonna put it on Abby Tyler's Healthy Living. Okay, post. And one more, just 1 minute there. I'm gonna say 1 minute. Okay. Yeah, we are. We are starting our second half and the conclusion of course, this is not completely comprehensive. There are so many other things out there too. So I'm just gonna go on and start. So let's review from the last time. I'm gonna put my glasses back on. Okay, last time around. Let me go in here. Now I'm gonna go into my page, to my notes. Again, I'm not a sex therapist. I'm not, and but this is something that I discuss with my patient because I also have to prescribe medications and also refer them to other specialties if it's something that's needed. Okay, so again, my disclaimer, I already said that. So, like I said, let's just go back and quickly review. I talked about one of the main things that have to do with libido. Libido meaning your desire, your want to be intimate with your partner over time, and for some people, over time as you age, that desire kind of wanes a little bit. For average people, that wanes a little bit. I'm not talking about people who are always like hyper wanting it and people who just don't want it at all. I'm talking about those who are in the middle. So this testosterone I talked about, that's the androgens produced by your hypo, your thyroid system and all that over time for men and women when you're in your 20s, it's still live and it's healthy. And usually I think based on nature and all, that's the time usually when you're healthy enough and you're virile enough and you can go ahead and start making babies. And over time, as for men, it starts dipping later on in the 30s. For women, it goes back up again in the 30s because usually biologically, that's when the body starts saying, okay, you're going to be getting to the point where you get into your 30s, late 30s and 40s. That doesn't mean you can get pregnant after age 40s and into your 50s, but it's safer for you to have it in between age 20 and 40 for less complications. Okay, that's just average. I'm not talking again, not saying this could happen, that could happen. So, and by then, and they get to the peak of their wanting to have sex all the time, and the body's like, okay, hurry up, hurry up, hurry up. Let's go ahead and do it because you get into the point where you may not be able to get pregnant eventually. So that's just a part of the primal part that we went through, I guess, through evolution. And then over time, and women get into the 40s, and when you start going through changes of different things, also you're talking about having children, having if you have like the kind of delivery, if you had any kind of chronic illnesses, people the kind of stress that we go through in life with family members. If you're in your 30s and 40s, chances are more than likely you have younger children and you have elderly relatives you would call them that sandwich generation where you have so many things to deal with. You and your husband may not be seeing eye to eye during that time, husband or whoever your partner is. So there's so many things that cause that. And when you're going through all the different stressful stuff and sometimes chronic pain. And I also said other things that if you have the issues where your bones are hurting and you had anything later on in life, you don't want to be intimate. Okay. And as you get older, and also it depends on your culture. I talked about that, your culture, your brain function, your religion. Some people are so religious and all that, and they don't feel that. When they think sex is only for procreation, meaning only to have babies, and you don't feel you should be doing that. You should even express your sexuality or even want to dress nicely for to make yourself feel good, not necessarily to make your man feel good. I know there was a time where when I was younger, I had my kids when I was like my first child, I was like maybe 25 or so. And I was like, oh, okay, yeah, I'm a baby mother now. I can be wearing this, I can be wearing that. And when I look back, I think it went on for a couple of years. And I look back, I'm like, oh no, honey, you're still, you're still a young woman. You're still a woman, regardless of whether you're a mother or not. You're still a woman, so you have to carry yourself, and there's nothing wrong with what you're wearing. It's not like they say you're going out there and just being flashy and doing things that was so outside of the norm. Whatever the norm is, I mean, people push the boundaries nowadays. I'm not yet to discuss that. And also, people like, okay, no, in our culture, especially Liberian culture, what I talked about, and some strict cultures, not just Liberian culture, African cultures, or cultures that are really strict, when it comes to like how women should carry themselves. And now even some places in America, they do that. Okay, well, no, you're not supposed to be doing that. A woman is not supposed to be like this. When you get to a certain age, you're not supposed to be acting this way. You just, take care of the kids, do the food, cooking, if you have to go to work, do your work, come home and sit down. You're not even supposed to be dancing or doing anything that express your sexuality to say that you're a woman. Yes, biologically you're a woman and all, but you still have, but they make it shameful. And of course, like, again, like I said, if you're a woman, if you have children after a certain age or get pregnant, it'd be like, oh, you're a woman now. What are you doing? You're supposed to be sitting home. You're supposed to be taking care of your kids. You're supposed to be doing this. And so they literally shame you. So all of that, the culture, your upbringing, and also all of that can cause the fact that when you're your husband, you get to your 30s, late 30s and 40s and 50s, you don't want to do that anymore. You basically not don't feel that you think you need to express that part of you anymore. That part should be tamed down because you feel once you get to that point, you shouldn't be doing that, and which is wrong. I mean, there's the culture. Don't be a slave to your culture, but at the same time, you can say, no, I do, this is what my culture says, or this is what my beliefs, my religious belief, my disbelief, whatever I see women as, and all. But you can still, you can always do a happy medium, especially if it's causing a problem in your relationship. So that was the reason why this person brought it to my attention and said, can you please talk about this, because it seemed to be a big problem in our family, in our culture, where when you get to like 30s and 40s, and then everybody wants to act like they're 99 years old. Okay, so that's where we are right now. And when I left you guys last week, I said, okay, so I've already discussed all the many issues that may lead to that. So what can you do about it? If you notice, it's not something where you say, okay, I don't want to do this tonight or this and that. But when you notice that it's been going on for 2 to 3 months now, and you're having a problem with it, and one partner brings it up, and you just kind of, I don't want to talk about it, or you don't think you need to be doing anything, then of course that's when you start having issues. And who is the first person to call, and just to make sure that everything is going right, because it's not just the woman, remember, now it's also the man. The man could not be wanting to do it, and you may be thinking he doesn't love you anymore or whatever it is. Remember that, just go ahead, and first thing you do, you want to bring it to your doctor's attention, okay, to your provider's attention. Of course, most people will talk about it to other friends and all, and this may also lead to other relationship issues. But you always want to make sure that you are healthy, because I did talk about the reasons, some of the medical reasons, like diabetes, heart disease, depression, and everything that can lead to that. So there are medical reasons behind it. Okay, so let me get to that. I've talked about that. And like I told you before, smoking, drug use, surgery, fatigue, pregnancy, low self-esteem. If the woman doesn't feel good about herself, or the man doesn't feel good about himself, he's not going to want to be intimate and all. Okay. Okay. So I talked to 20s and 30s. So let's get to, what do you do when we get to, okay. So get the recap. So where do you start first? Let me take a sip of water. Oh my goodness. There's some questions over there. Let me just see what's going on here for a second. Okay. Thanks for the update. Watching from District Multi. Okay. Oh, I have a lot of people watching from Liberia. Hello, I'm from Luffa County. Francis Ferguson, I'm interested, but I'm in River G County. Which can I be a part? I'm not bringing on anybody today. Next time, maybe next time I'll open when I finally start getting people on, and I'll open it and I can get more people to come on. Okay. But fortunately, I'm not. You can always leave your questions and comments below, and I can discuss them. Okay. So the first thing you want to do if you start noticing anything, or you're noticing your desire, and also the fact that I talked about in the age, about age 40 for men, you start having some erectile dysfunction issue, meaning that you're having problems getting erected, you're having problems maintaining the erection, and then also that also kind of loosen the desires too, because if you're going to be being intimate with your partner and you were lasting 20, 30 minutes at a time, and now you can barely last 2 minutes, even when if you're much younger too, you want to bring that to your doctor's attention because we always want to make sure there's nothing more serious going on. Okay, so it's a natural challenge change. Like you want to make sure you talk to your doctor. So when you come to see your doctor or provider. When you come to see me, first of all, we'll listen, we'll talk about it, and it's an honest conversation. It's not something I have people come to me who that's the only reason why they come to me. Okay, and that can be like the complaint, chief complaint to come out, and we sit down, we talk about it. But we always want to make sure that we take rule out all the medical serious issues first. So we're gonna do some labs, okay? Because you're telling me how actually are you having a problem, especially for the woman too. We'll talk about that, but mostly men usually come first, all right? And again, like I said, for women, they don't feel based on your culture, you shouldn't feel like you want to have it more often, like you know. So we'll do some labs first, okay? We're gonna be testing your testosterone level. We'll be checking your thyroid level again because your testosterone is produced by your thyroid gland. I did a show on hypothyroidism and hyperthyroidism, how it affects your sexuality and your sex life also. Because the thyroid gland that is right underneath here is the motherboard that controls everything. So it has to make sure that it stay within range for everything to work effectively. Okay, so we'll do the PSA level because we want to make sure, especially for men, we're going to be asking you when you do go to urinate, are you urinating also for prostate cancer people too, and enlarged prostate, which is called BPH, benign prostate hyperplasia. So want to make sure we tell you, I said, when you're urinating, do you feel is the urine coming out a little bit at a time? Is it all over the place? You feel empty after you urinate? So I'm asking you that because I want to make sure there's nothing that's blocking the prostate gland because it's right in between where the urine comes out and where the sperm comes out. So it's right behind there. It sits over there. So it can be blocking that and making the little tubes kind of real tight. So I'm going to be asking you that. And so if that's the problem, I'm also going to be thinking prostate issue. So, and usually like the most, less serious one would be the BPH. Like I said, it's just showing an enlarged prostate. So because of that, we're probably going to put you on some medication that's going to loosen it up so you can be able to pee better. But because of that also, and then if the problem continues based on the PSA level, which is the prostate level and the testosterone, all that, if the numbers are pretty high and they fall outside of the range, we may have to send you to have an ultrasound to make sure there's not something serious that's black, or you have something going on there that could be beginning stages of prostate cancer, which is more serious because if that's what we're dealing with, then we're not really dealing with the sex part anymore. But that is also important because that's also a main part of a man, meaning that, okay, if I cannot do that anymore, then that part of me that makes me a man for most men, that part of me that makes me a man makes, will make, nobody wants to be dealing with that. You want to say, I don't want to do it because I don't want to do it. But you don't want to be forced to get to a stage in your life where you're not able to do it because of cancer. And the cancer is very serious. If it's not caught early, that can travel up your back and all that, and then eventually get to the lungs and all. So we want to make sure we rule that all that out of the way. We're going to test you for diabetes. We're going to be checking to make sure your electrolytes, checking for your liver function, all those things that's supposed to that control your body. Okay, for women, we'll do your hormone check to make sure if you're not, especially when you're in that 30s in late 30s 40s area, we're going to be checking to make sure you're not beginning stages of menopause. Also, we're going to be asking you, are you checking, for your breast and all that, start getting your mammogram. We'll be checking also, and for women, checking like as again checking for your hormone level. Are you seeing your period every month? Are you skipping are you making sure that you're not already pregnant? So we get all the medical part out of the way. Okay, and like I said, for women, if you're having any issues as you start getting older and the body is not, your hormones start going down, your body not putting enough secretion, so you're not lubricated enough. So it takes a little while to get you to that point, and you don't want to be having painful sex. That also it takes the fun away. okay, or takes the pleasure of being intimate with your partner. Okay, so we're going to be checking that, and that can be easily remedied by the doctor giving you, again, like I told you, like a natural estrogen that can be bought, and you put it on. It mimics your regular estrogen. So it's not putting something on there. Some people also can do KY jelly, but that depends on whether you have any kind of reaction to the KY jelly. But that they have so many different brands now, and so the KY jelly is the main brand, but they have so many. They made it so white that it mimics your natural lubrication, but so you can also use that. And don't be ashamed, this you and your partner. Okay, if your partner is about your age, or if he's younger or whatever, he understands that everybody goes through changes. The same way how you will understand that he's not going to be able to continue until, to the break of dawn, like when he was 20 years old. Of course, you're not going to be able to sit there and be the same person that you were when you were 20 years old. And I see sometimes, again, like I see younger women shaming older women and saying, I keep telling you, every time you have a birthday, you are getting older. You have two choices, to die or to get older. So don't make fun of anybody. Oh, this one's old now, she this and all that too, and you're going through this, and you're all going through that. As long for as I can guarantee you, if you get older, you're gonna go through the changes for men and women. Okay, and then sometimes women go through that. They say, "Oh, I'm not this young girl like I used to be. I can't. My husband doesn't love me. He doesn't see me in the same way anymore." No, that's it's what important is communication. Communication again. Go back to when you were younger and have these conversations and say, if I get older, when we get older, these are the things that we're going to be dealing with. How are you going to feel about it? And because even if you just get older, nothing happens. You can still have accidents. You can have so many different things that may cause you not to be able to perform, that may cause you not to be able to want to do it. So your relationship will go through a lot of changes that you need to have that conversation before. Okay, you're not going to be hanging from the chandeliers forever, and there should be no reason why you seek something somewhere else because your partner is no longer and interested in doing that or can no longer do it. Okay. So again, like I said, you will check the women for menopausal symptoms, and if there's anything going on, we can put her on hormone replacement therapy. Most of those medications that's supposed to help with menopausal symptoms, like the severe hot flashes, because there are some women who cannot tolerate going through it, and the hot flashes. I mean, you're talking about heart issues, you're talking about so many other issues that come along with menopause that can really break you down to where you won't be able to perform like you used to, even regular daily activities. So you may have to go on those medications and all that. At the same time, they have to make sure you don't have any history of breast cancer because those medications only are supposed to be there. So please, if you're going through that and you're talking to your GYN, your gynecologist, making sure that you're not supposed to be taking it for more than 3 to 5 years because they also can cause other problems that you're only supposed to take it for a little while until the symptoms subside, until you get over to the other side of the menopausal symptoms. Okay, so and we're also going to rule out, make sure you don't have any cardiac issues. If your heart's not beating okay, your heart's got any problems, and you saying that try to continue doing what you're doing, all that blood, guess what? That's what they tell you. You see the Viagra commercials, and you see all those other stuff. They tell you, if you have an erection more than 4 hours, go to the emergency room. But if you have heart issues, you could die. I know a couple of people who they were supposed to be taking the time and doing the right thing, and they weren't taking the medications, and they end up dying. I mean, there were people who, are in community. Some people know, they know that because you hear it at the funerals. So you don't want that to happen to you. You want to get checked and all, because I understand, yes, you want to be pleasurable and you want to be intimate with your partner. And sometimes, but no, don't be doing anything without getting checked to make sure everything is okay. So we're ruling out diabetes. Like I told you guys, diabetes also affects the circulation, and that can also affect the circulation down there. Most men, if you taught them to make sure they take their medication the right way, or they don't want to do it, but if you tell them, oh, guess what? If you don't do that, eventually may become impotent. And then it's like ding ding, and then something goes off in their head, and they understand everything we're talking about. I also did a show on diabetes. You can go back down and look down. For those of you who are watching from Focus on Liberia, also, please make sure you go to my page, Abby Tyler's Healthy Living page, and just hit a follow there for me, please. So at least that way it can kind of increase my followers. All right. So we'll do that. We do other, like again, I said, we go through the different thing, which has vitamin deficiency, because if you have vitamin D deficiency, if you're tired and you're not moving around that much, vitamin B12, your folic acid, we check for all that to make sure there's no medical costs going on. And then maybe, so we can always supplement whatever's going on. We make sure you send you to the cardiologist, then make sure they do a cardiac workup, make sure you're fine, making sure your A1C from your diabetes is under control, because if it's uncontrolled, that could cause a problem. So watch my diabetes show and go on from there. So, and if it's just something that's just okay, age, we'll be like, okay, find a way to get, again, like I said, when you want to get intimate, and as you get older, it's not just going to happen just like that. You're not just going to be like, okay, let's go to get something done, and you just get it done right like that. It's going to take a little while. You have to work and, work your way up, touching, feeling, looking at each other, doing all the little romantic things that you have to do that would get the person in the mood. And eventually the brain sends the message down there and says, okay, we're ready to get there. Let's get there. Let's do it. And like I said, if you get to a point where it's like the person can only last 5 minutes, don't be shaming them. Okay. Because I'm sure he's feeling bad about that. And you also, he may be saying, okay, why are we stopping? Because am I hurting you? And then you don't want to feel that, okay, I'm not as lubricated anymore. Don't do that. Talk about it. Okay. Talk about it. Talk about it. All right. And also some of the other ways too, you want to make sure that you're exercising. So exercise and physical fitness. When you go to the gym, you feel more energetic, increase your endurance, exercise, activity level, weight. Make sure you're keeping your weight down, because if you're really heavy, I spoke about healthy weight, and you're breathing heavy, and you have to, especially if you're the man and you have to be on top for the longest time, you're not going to be able to do any endurance, especially if you haven't done exercise or to build up your endurance. That could also kill you, because you're giving your heart so much stress to do all of that. That can cause a problem. So stay healthy, stay physically fit, have a healthy weight, so you'll be able to do any kind of hectic exercises too, which is what sex is. Okay. So just, even you don't have to be all buffed and lifting 700 pounds. Just exercise every day, 30 minutes, 3 days a week or more. Do some weight lifting, do some running, do some walking if you can, jogging, whatever way. Just make sure you're doing something that's heavy, and that would build up your endurance, build up your heart rate. Because if you want to be able to do this, you got to be able to do this part. Okay. Again, I talked about obesity, and I also talk about, keeping a healthy weight. All right. In women, also women do the same thing, because if you want to be sitting there, he telling you get on top, or just get it from the other 10,000 different directions and positions and all. If you can't breathe, or you having problems going on there, that's not going to be fun. It'd be like, okay, yeah, let's not do that because I can breathe, or let's not do that because my bones hurt, this hurt, that hurt, and all. So the more exercising every day, and you're not just going to be doing, and the benefit of that is you're going to make yourself healthy eventually. Okay, so which is the most important part. But I understand sex is an important part of life too. So, but because you stay healthy, and it's not just doing it for that. You're having a healthy lifestyle. It's a lifestyle change. You're eating healthy. Make sure you're eating healthy foods. You're eating high fiber food, so all of that can get out of your body. Don't eat late at night, because you're keeping all that food on your body and you're not doing anything. So make sure that you're eating healthy and exercising at least 30 minutes a day, 3 times a week or more. Okay. So exercise, what it does, it helps you increase your energy and stamina. Stamina, want to make sure we can get that and get all that good stuff going, right? You'd be like, come here, girl. I'm gonna work you from now until like next year. And you're like, oh, girl. Okay. So yeah, you want to be able to do that and not just be talking, but at the same time, don't go die on anybody's child. Okay. Sorry. Okay. It boosts your heart health, it improves your mood and mental health. Also, it help manage chronic. I already talked about so many different ways of doing this, and it lessens chronic pain. So you're going to be helping yourself at the same time. But then at the same time, and also it also comes out, like I said, role playing, dressing sexy. Some days, it doesn't even have to be overtly sexy. Just wear something to make you feel nice, and put you to feel like. And don't forget that young, beautiful girl. And this, that I said, I talk about sex and all that. This is talking about when you, as you grow older. Don't forget that young, beautiful girl that's inside of you. Okay, don't forget that. Don't you at one time you were this young girl who was like taking care of her hair and taking care of her face and dressing nicely. I'm not saying when you're 50 years old or you're 45 years old, you should dress like you're 18. There are so many beautiful clothes that you can wear at that age, that you don't have to sit there and be competing with your 18-year-old niece or 18-year-old daughter or 21-year, no, or the girl down the street you think your husband's looking at, or your husband, men, you think your wife is looking at this buff person down the street and all that. So it's like, so just there's some ways to keep that sexual part about you, your sexuality, and you're not just doing it for him, but it also helps if you both are like kind of keeping yourself looking good for each other. Okay, that helps with the relationship too, because you're sitting there, you're saying, oh, you want for your husband to walk in and you be like, damn, okay, all righty, I see you. And, and then when your wife walking, you be like, and then, like you posting pictures of her, or you talking to your friends and be like, yeah, that's my woman right there. Yeah. It's like, you're sitting there and you see a person who you've been with for so many years and you still have that feeling about her. Okay. And I mean, of course, yes, you're going to be talking about things that it is children and work and everything else and family relationships and family problems and all. Yes, those things will come into the way, but at the same time, you want to keep that loving part in the relationship. And it doesn't take much. Just do things, laugh together, go out together, go for a walk. Okay, wear different clothes and keep yourself like that. So that way, keep that part, that romantic part stays there. You're not just old parents. You're not just old people growing older. You're still attractive to each other. You're still attractive to each other and attracted to each other. Okay. So, and like I said, exercise will boost your self drive. Okay, and eat foods that would make you want to that would eat libido enhancing food. Okay, so some of the food may help increase your sex drive. Many of them improve by they do this by improving blood circulation. So the blood circulation and your body's healthy. Of course, the circulation down there and the circulation everything that you need. Like I said, you're eating healthy, the heart's working okay, and it's working, moving the circulation all through the body, and it's just making you like, oh, mm, okay. Anyway, so it's important that you eat improve, and that's important for erection and also for female arousal, like I just said. All right. So some of the foods that will help that increase your libido, improve your mood by changing your brain chemistry again, because all of that. So libido causing food like raw oysters. Okay, and some of those food words, because that oysters, I guess when you take it, you eat it, it's like kind of raw, and it's like all the minerals and everything, the vitamins in there, and especially if you're eating that in front of your partner too. You sitting there, got your oysters, and you eating, and all that stuff is just dripping down your face. You have to be playful when you get older. You can't just be sitting there and just be like, oh, let her eat it for. You got to find time to be playful, right? Okay. Like men always talk about bitter cola. That's supposed to be almost like Viagra and all, but please be careful again. Like I said, get checked first. Okay. Bitter cola. We used to eat that for, I think, back in the day when we're studying for school to keep you up awake. So I guess if it works to keep you awake, I guess it keep you awake down there too. I guess so. That's the thing. People, you need to take it into the lab and get study that so people can make a lot of money, patent it and make a lot of money. Okay, you're gonna wait there until people come to your land and take it and then make a lot of money from it. Because I remember one of my American patients acting that. He said, "Oh," he said, you're Liberian, you're African." He said, "Oh, what about that bitter cola?" So it's like they know about this. So hurry up and get that in the lab. Okay, avocados. Okay, which is butter pear, what we call butter pear back home, nice and soft, and you just kind of cut it. Even you want to do, like I said, be playful, cut it nicely, and just kind of slip it down and just put it in his mouth. Feed him, let him feed you, and all of that. And then lick his finger after you're doing that. Okay. Anyways, blueberries again, be played for watermelon. The watermelon kind of helps with that too. The watermelon itself, but then when you take the red part of the watermelon off, the white part is called the rind of the watermelon. That's the one. So we talked about that one time when we said people were taking the watermelon, just throwing away all the good watermelon. So just cut it up a little and keep it for the kids, the red part, or for later if you want to eat it. And then just take the rind of it and just cut that up and just eat that part. That really gets everything where it needs to be. Okay, sweet potatoes, all right, nice and soft with butter. Spinach, which is would be like, I guess, potato greens, the equivalent of ours. Garlic, there's a garlic, onion, and shallots, but I would suggest that you eat that and then make sure you get your breath all nice, and because that's a turn off too. But apparently, the ingredients in that kind of enhances everything. Okay, and drink like nice wine, little wine here and there. If you got other issues with active addictive behavior, no, don't start drinking any wine, but you know yourself. Okay. So some of the things that will lower your ability, that will decrease your libido, decrease your self drives and function, and also lower your testosterone level, so you and impair your circulation. These are the foods that you want to stay away from. Again, alcohol, of course, because that's a depressant. So if you drink that and you drink too much of that, you're just going to be drunk, and then you're not going to want to do it. So, but little sips here and there to just kind of loosen you up, especially if you're like, you're really anxious, you're in a relationship, committed relationship, and you're home, you're not drinking to go anywhere else, you're not at a party and about to drink from there and say, "Oh, girl, when I get you later on tonight." No, make sure you're already home or not going anywhere, and then do that and make sure, and then you can go on from there. So just kind of loosen you up, but don't drink too much because it's depressing. And if you take any medication, that can also affect that. So don't want to do that. Saturated heavy foods, because if you're too heavy and you ate too much, like beef and pork and butter and cheese, all of that, it just, again, it adds to the unhealthiness of your heart. Also, and it raises your cholesterol. Also raises the fact that it may put some weight on. So then you're not going to want to be able to do it because you'll be so tired from eating that heavy stuff. That doesn't mean you shouldn't eat it. Of course, you should also eat food and get your proteins here and there, but just kind of in moderation. Okay. Like fried butter, chutney, margarine, all this different thing, mint and menthol, licorice, tea, and soybeans, soy product. I just say that, but of course you need to, if you, especially for soy milk, you need that. If you can't have regular 2% milk or heavy carb milk, you want to eat low fat things. So those things are important depending on your present health condition and all. Okay, so, and anything, like I said, again, don't eat very heavy. Make some romantic food. He can make some romantic food. Again, like I said, feed him, let him feed you. Okay, and when you stay away from all those things, it keeps you healthy. Manage your stress. I know we live in a world where there's stress every day and nobody can really take away from that, but you can still manage your stress and don't take it into the bedroom. When you go into the bedroom, your bedroom should be for sleeping. Maybe hold on one second, let me just drink a little bit. Maybe reading, but don't take don't get in the bed with you and your husband and you're there and you're with your phone like this, he's with his phone. Of course you can do that, you can look it over a little bit, but don't, there should be a romantic place where you go to be there and then make love, or you can do it anywhere. It doesn't necessarily have to be in the bedroom, you know that, right? Anywhere else, or just don't. Yeah, and some people say, oh, you can do it somewhere where it's like you won't be scared to do it, and it's like the risk and all that just increases the intensity and all. You get to a certain age, you better not be doing that because there's cameras everywhere. People have their Ring doorbell, and people have like different surveillance cameras, and all these businesses have cameras and all that. You don't want to be caught doing that, especially if you're just kind of person who everybody knows. No, don't be doing that. But just do something differently and go for a walk. Sit down, and the thing about it is, it doesn't have to be sex all the time. You can just hold hands and just caress each other. Just massaging, let him put some lotion on you. Get out of the shower and still, can you rub some lotion on me and all that? Rub some, and sit there, rub me and say, tell him rub it back and do it. All of that. That just kind of answers, because when you're sitting there and you're rubbing the lotion on, that increases the circulation and all, and increases the circulation there. And he's putting that lotion on you, and you putting lotion on him, and next thing you know, bam, music happens. So do things differently, okay? I'm not. There was this person on here, I think Lady J. She knows how to talk about all this stuff. I'm not taking your place. I'm just talking about the medical part of this, okay? But she's really good. Okay, so eliminating the stressors, learning different relaxation techniques, exercising, meditating, using mindful based techniques, doing some yoga, soft, like, you love soft music. I love going to the waterfront. I love sitting there and just playing around and just walking in the park, holding hands. These are things that they may not be normal to most people, especially from certain cultures, and say, oh, you're old now, you're not supposed to be doing that anymore. That's something you have to learn. You have to retrain your brain into doing that so you can have a healthy relationship. Okay. And it's also when you lower your body, your stress level and all, it kind of lowers your cortisol level. So you're not sitting there just working so many different things that it increases your risk for infection. Okay. Also making sure when you go to sleep, make sure as an adult that you're getting at least 6 to 8 hours of uninterrupted sleep every night. I did a video on sleep apnea, which is the absence of breathing when you go to sleep. All that can also affect the libido too, because if you wake up in the morning and you're not feeling like you got enough sleep, and you're drowsy all day and you're not performing well at work, of course, when you come home and you go to bed, you're not going to be performing as well. And if you have other issues, that also affects the heart and also may cause a stroke. And also you want to make sure that you're getting at least 6 to 8 hours of sleep, uninterrupted sleep. If you have to get up, you get up one time to go to the bathroom and get back into bed and go to sleep. Okay. And sometimes when you go to when you and your husband being intimate, it doesn't have to be at night. You can always, you know what to say, you know what people like to do in the morning, because that's when everything's nicely marinated. So try that. right? And then you can go back to sleep. Or some people say, "Don't bother me, I'm trying to sleep." But do things differently. Do things that are not so no, so like, okay, this is what we do. This is what we do. This is what we do. Be spontaneous. Do things differently. Okay, so that way, and then, like I said, make yourself young again. All right, not so much young as in young, but don't lose that feeling that you both got together when you were high and mighty and also into each other. Do different things. All right. And also, like I said, have a relaxing bedtime. Use by your bed for sleep. Make your bedrooms quiet, dark, and cool, where it's a place of relaxation. If your kids sleep with you, you have to work around that. Okay. So reconnect with your partner. If you're having issues like this, also after speaking to your medical doctor, you may have legitimate issues in your marriage where there may have be something that going on, or maybe like an extra marital relationship. There was a child that was born out of that relationship. There are family members that interfere in your relationships and all that. So you may have legitimate issues that you may need to talk to a counselor, and you can talk about that. So he may be thinking, "Oh, I don't understand this and this, and she was just having some issues with my family. I don't understand why she doesn't want to do it." And sometimes, like I said, men think that you can leave from a funeral and be intimate 2 seconds later because they think about it more than we do. But some women think about it too, and there's nothing wrong with that. That's just how they're wired. Okay, so but at the same time, if you're having legitimate issues in your relationship, of course you want to get that checked. Okay, and speak to a counselor. If your doctor would refer you to see a counselor, and you guys can sit down and talk about those things, and then also talk about your intimate life and move on from there. Okay, so if you're doing that, let me see. Say, like I said, turn off the devices, talk more, role play, and like I said, you can dress up different way and see if you and your partner want to get all sexy up about it. Destination, go to a different, watch the movie, listen to when they talk to you, touching in a loving manner, and touch more of them. Let me give you see them. Just rub, come down the arm, and all just feeling back and forth and touching the face and just smelling them. Like sometimes if they're wearing like a nice perfume, just reach over and just kind of smell them. It's like, you're smelling that intensity. Okay. Take a quiz. You can do a quiz and say, okay, honey, they have love quizzes on Google. Don't get all crazy about that, because if his answer is different from yours or her answer is way different from you, you could get in trouble with that. So make sure it's playful. Okay. And again, like I said, talk to your counselor. If you have to see a counselor, talk to your counselor. Pay attention when he or she's trying to talk to you. Okay, don't say, "Oh yeah, you're watching TV," and you don't, of course, and don't try to talk to her about something serious when she's busy, or don't talk to him when he's just came off work. She just came home from work. Find a nice time to say, "Can we just talk later on tonight when we're both in the bed together, or we're both sitting somewhere and having this nice conversation?" Go outside, have the conversation somewhere else. It doesn't necessarily have to be in the house. Okay. So how can you work with a partner who has a higher libido, higher sex drive? And some people would just have you have mixed max sex drive. Again, it goes back to your culture or your religion and all that too. But some people, when they get to a certain age, they just don't feel like it. And some people have never been into that much sex, all that stuff, anyways. So what you do, you want to understand that none of that is abnormal. Okay, sex drive varies differently. Some people, that you'd be like, I met my husband, he always wanted to do it from day one and every day. Okay, I met my wife, she was always wanting to do it and want to do it 10,000 different directions. That's how she's been all her life. And so that. So eventually one of you may not want to do it all the time. So eventually talk about it. Talk is most important thing is communication. Saying this is how I'm feeling. Okay, I don't feel like you want me anymore. I feel like what is going on that yes, if whoever does the cooking, or whether you're eating or you're coming home, you're paying the bills, you go into work, you're doing everything you're supposed to be doing as a husband, you're doing everything you're supposed to be doing as a wife, but I feel that our intimacy is lacking. And I'm not just like my sex partner talking about, you don't touch me anymore, you don't hold me anymore. And that song, you don't bring me flowers anymore. I know they say don't wait for your husband or your wife to buy you flowers, buy your own flowers. But sometimes you want them to buy you flowers because, yeah, I mean, you're in a relationship. Okay. So talk about it. Sit there and say, honey, this is what's going on. And I just really want us to talk about it. And he may think that you're nagging, or she may think that you're nagging, but it's important. And for the longevity of your relationship, you do want to talk about it. And you want to give it a must try and get help. And or of course, if it gets to anywhere where it's abusive, then of course you have to make the choices that you have to make. But if it hasn't gotten to that point, if it's safe, it's just the intimacy lacking, then sit there and talk about it. Okay. Again, like I said, you can always just stick his fingers and just suck on it, suck on her finger, play with her, touch her when you're in the car, holding hands, and just feeding each other. Listen to some lovely romantic music, bathe with each other. You can, rub each other down, be like, I know you're so, bathe me down, do all that. Do things that would make you happy, and it makes you happy. And when you're happy and you're feeling fulfilled in your relationship, people can see it. They can see that glow. They be like, "Oh, girl, look at you." And it's like, okay, okay, all right. So all of that, okay. So talk about it. Like I said, what manage your stress, find alternative ways to reconnect, connect emotionally, and all that, and just talk. And like I said again, it doesn't necessarily have to be sex all the time. You can just talk about different things that make you happy, and talk about things that you used to do when you were younger, that that everybody so you say, remember when we went to that place, remember when we went to this date, remember when we're doing this, remember, reconnect and talk about happy times. Again, like I said, it doesn't necessarily have to be sex. I don't understand while I'm talking with this tiny voice today. I guess maybe because of the topic, but just do that, okay, and just hold hands and just loving each other. I wasn't just gonna be talking about just sex. This topic was mainly about sex and as you age, which was the main reason behind this topic for the first thing. But yeah, when you're younger, have that conversation now for couples who are younger. And it's not just older people that are having this problem. There are some people who are younger in a certain age, wherever something happened to them when they were much younger, or how the family looked at sex and all that caused them to not be that kind of romantic in a relationship. And then also, like, you also have men who are stupid, who thinks that if a woman wants it all the time, or the woman just wants a healthy sex life, that means she's probably sleeping around, or she's doing something, or she had like a really heavy past before. She must have done been so many different things and done so many things for other people. That's why she's like this. And I don't want my woman like that. Most men want to sit there, they want to sleep around. Not most men, and I shouldn't make this general, but they want to have like other girlfriends who like freaking the sheets. But then when they want to get married, then they say, okay, let's marry this nice little virgin girl, who this person who's going to say, oh, let me just lay there and you do to me because I don't know anything else. And even after that too, after a while, that would get boring, because he'd be like, okay, can we do something else? This is going to be like the missionary position every day. Can we just do something else? And again, like I said, your orthopedic abilities also. Are you able to, don't go doing anything, having her doing this and all that. And when her knees are hurting her and her hips and all that, when he had a backache for the longest time, and you go tell him, all let's do is pick me up and put me on the table, put me on this. No, hey, you don't want to hurt his back. I mean, it should be playful. It shouldn't be painful. It shouldn't be so much stressful to like please each other. There's so many ways to do that. And as you get older, talk about it. Talk it from the time you're younger, and start talking about it as you get older, and bring your concerns to your partner early on. So don't wait till it becomes a problem. Okay. And then you bring it up. And then after a while, especially when it's so far gone, and women, don't be afraid to tell your husband, I want more intimacy. I want you to touch me more. I want you to do this to me. And sometimes you don't even have to say that. Sometimes just show him, give him signs. But yes, but you do have to talk about it, because in some relationships, you do have to talk about it. There's some men who I will culture that say, if your woman's getting older, then okay, you need to be getting somebody who knows, or you need to get a girl, the woman that's got identity, meaning in America, the perky breast. Okay, she's got to be this, she can have this. And those women, oh yeah, my boobs are not as perky as they were before. I got a little bit of cellulite here, I got a little bit of stomach, I got a little bit of this. Honey, you are fine. You are fine. You got this, you got that. Drawing some bangs, putting stuff, and there's so many clothing out there that can disguise everything and make you look good. And if that man really loves you, if he really loves you and see you for who you know, that he would understand that when you get older, as you get older, your body will change. If she really loves you, she's going to understand that as you get older, your body will change. Yes, you're not going to have that same six pack like you used to before. It's going to work out fine. Okay, so just have the most important thing in all this is communication. Communication. Be on the same wavelength when it comes to cultural in changes, and then talk about how your culture interacts with each other. If you're in the other relationship, or intercultural relationship, or interracial relationships, talk about the different things that brought you together, that made you love each other, and things like what is your view on sex as you get older. Have those conversations, and have them very often, especially when it gets to a point where you notice that it is causing problems. Okay. So I think I covered everything so far. I am going to just go in there and look at the some of the comments, and then we'll be, oh my goodness, I didn't think I was going to talk this much. Okay, so let me see. Isaac said he's watching from Minnesota. Hi, Isaac. Isaac Harris. I hope you enjoyed the show. And I think Mike King says sex is life. Yes, it is. Yes, it is. I say it's important. It's an important part of life. And it's enthusiasm. Yes, Ruben says enthusiasm. So, yes. And let me see. Sunday said, Sunday to watching from Kakata City, Margibi County. Welcome to all you people who are watching from all those places. River Cisbro said that's when the young kids, young side chicks come in. And I did talk about that. I said you may have relationship issues where the men decide that, oh yeah, she's this now, she's not doing this anymore, she's not swinging, and I don't feel it anymore, so I need to get my groove back, or I need to get somebody who's much younger, and that's so unfair. That is so unfair, okay? Because most time the women are going for younger men, and I mean some people do that, but to start having that conversations right away and very often, okay? And Augustine Tamba said, apart from money and sex, what else is very, very important in life? I guess love and family and health. Health. Most important thing mostly would probably be health, because once you have your health, you can do everything and all that. That's why being a provider, I always talk about preventing different diseases, or delaying the disease, also delaying the complications and managing the complications as well. So your health and other things, and the cultural values, you can tell you what's most important in your life. You can determine that yourself, but also your health and all. Okay. And Wilson said, how do you do all of these, madam? How do I don't know exactly what is all I do. If you want to specify while I'm still on, I would answer that. But I don't know exactly it is, so you have to specify on that. And Augustine Musa said, good evening, good morning, Augustine. And Jackie Jackson said, eat dessert together and feed one another with some cherry on top. Dang, okay, cuz. Suki now. Get them, put the cherry in whipped cream, and just, oh, okay, okay. Hi. So, make sure that, that's what he was. Okay, let me see what else she said. And Victoria's Secret and Bath and Body Works. Just yes, 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 yes. This nice little smelling perfume and nice lotions and all. And make sure and then you can put some nice candles, but please make sure you do it safely. You watch this show on TLC, not TLC Africa, TLC, the TV channel that talks about different things, and also talk about how sex sent me into the ER, and people try to get sexy, and they put on these sexy lingerie and put the candles and almost damn near light their house on fire. So you got to be careful, okay? And don't do anything that's going to be, do anything that you're allergic to, because if you go put some lotions and potions on and you turn out to be, so be careful with that. And Kaluba said, yup, psychological issues will affect your libido for sure. Great point. Yes, 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 yes. I mean, if you sit in there, especially, and I also talk about people who have anxiety and depression too, that diagnosed disorder. So if there's something that's chronic, and if it's not being managed well, like you're not on medication or you're not getting therapy and all, that's gonna make it, because you'd be like, okay, the wife don't want to do anymore. She just every day she said she's in, so then you start talking to other people, and then before you know it, everything that you should have been doing together, you're doing it with somebody else. Okay, nobody's perfect, and these things happen. So as long as you're talking about it, all right. So my client said, hello, Miss Abby. I feel like I like feeding her fruits in a nice glass of wine, then massaging her down with some lotion, making love to her, and then fix and serve her breakfast in bed. Okay, Mike. Okay. And then make sure I told my ATHLers, you guys know all the tricks and trade. Okay. And as long as she's happy with you, that's good. And make sure she's doing stuff for you too. Okay. Making sure she's rubbing you down. Like I said, you guys can just rub each other down with some lotion. Okay, and let me see what Jackie said. Healthy spaces make good relationships that lead into some great sex over and over, just like day one. Yes, like when you remember you first met your partner and your first time you got together, I was like, bam, bam, bam. It's like just and then the talking to each other when you're there and you get in there and just breathe and just smelling each other's scent. I always said I wanted to go to Liberia, where someday when I get older, it's like older, I'm like already older, go there and go and, like somewhere where it's like the jungle, where like a nice little hut and everything, and you're there and you hear the music, drums beating in the background, and the kids is playing, and the people in the market, and you just hear your lover, and you're together in a nice hut, and you're there, and it's raining, and it's tropical rainforest and you just make love, and then it's like you just sit there and just fall asleep, and then later on you go and bathe in the creek, and then just go back again and just I don't know what I was like. That is my dream. So I need to go to Liberia and do that before I, you know, I show my some of my aunts are probably watching this and say, "Oh Lord, okay, okay." And yes, a closed mouth is never fed. So people need to talk. Yes, yes, yes. Communication, communication, communication. Okay, and it's the way you say it too. Okay, so Augustine also says healthy living doctor. Yes, you want to be. Yes, thank you. It's all about. So that's what it's all about. Marjorie says foreplay is a must. It allows both partners to be in sync. Yes, yes, and foreplay can start from anywhere. Anywhere. You can start from the car, like I said, touching, just sometimes you're just looking at your man and he looking at you. What's that song? Natalie Cole, Little Bit of Heaven. It's like you all at a party and it's the last guest has gone. And, I can see you're thankful as I. It's funny because that song is one of the song I heard when I was coming to America to play. So I always remember that song, play that song. You guys need to listen to that. Natalie Cole, A Little Bit of Heaven. Most people remember I played at my aunt's party the other day too. I was like, everybody was like lifted up and just feeling that song because it tells you, so all of that. It doesn't have to necessarily start with just, in when you get in there and already, undressed, but you can start with that. Start with this. Look at him. Do some things and just look across the room and just be like, and give him that look and all. He understands it. You understand it, and going from there, and just and like again, like I said, just touching. Let him, finish up and be like, "Oh, I'm so done," and all that. So, and it doesn't necessarily have to be in the bedroom. It can be anywhere. But if you have small children or you have people who have the keys to your house, maybe you might want to. You might just want to like be a little safe, okay? But do something different. Do something different to keep it alive, okay? And you need a three board. I know. I can't. I can't do this. Jackie, my young cousins are watching this and they're like, "Oh my God, cousin Abigail and my nieces and all." So, but yes, do that, okay? And just do things that would make you happy. So, and let me see here. Consultation is not easy skill to learn. Required does take the application of estrogen, egotism, and passion, the cultivation of frankness and freedom of thought, as well as courtesy, openness of mind, and wholehearted acquiescence in a majority decision. That's a lot there. But is that who's that? Haruna? Sorry if I'm saying your name wrong, Keita. Yes, I mean that's something like I said. That's something you have to do from the time you're younger. Okay, you have to when you're in a relationship, start talking about it now. Make sure that communication is the most important thing in your relationship. You cannot do anything else if the relationship is getting so at the point and you're sitting there, you're not talking about it, and then you think when you're 40 years old, that's when you start having problems. And he may say, "Oh, it's also the ego." I know I don't think I have any problems. No, I don't think, I'm doing as much as I can. I don't want to do it. You think I'm gonna be hanging from the chandeliers when I'm in my 40s and 50s, when my leg hurts, when we have stressful things going on with the children, stressful things going on with our parents. Again, you have to talk about it more and more often. So when you get there, it'll be easy for you to talk about. And also be told, just to summarize, because we're going on to the 1 hour mark. I didn't think I was going to talk this long, but just making sure you talk about it, and then also making sure that you go into your doctor and get checked, because I don't want you to get to the point where you're thinking that it's just okay, I don't want to do it lasting on a 1 minute 2 minute, and you're too embarrassed to talk to the doctor, and then you turn around and it turns out that it's like prostate issues, especially prostate cancer. So you want to get your, and I have patients who sometimes they come to see me and sometimes men, and I'm like, okay, let me take a look at it, and they're like, "You're gonna look at me?" I'm like, "Yes, I'm trained to feel for everything. I'm trained to do that. I'm female. I'm trained to do GYN examination, and I'm a professional. So it's not like to say I'll be like, "Oh no, no," and it's always there. And if you women, if you have to go to a GYN, a gynecologist, that you don't feel comfortable, if it's a male gynecologist, you can always call ahead if you're establishing care with a new gynecologist. Just making sure say, okay, I don't want to have a male gynecologist. You have every right to do that. Okay, my gynecologist, he was a male. I didn't bother me. Also had a female there too. Sometimes I went to her because it was content. Sometimes with her, I would talk to her. And then my GYN was also my preceptor in school. So people used to say, "Oh my goodness, your teacher is also that." After a while, we're all professionals. So I know we can keep that, because sometimes he'd be like, oh yeah, and Abby's my patient too, so she knows how, wonderful I am. And the patients would be like, ah, but we all do this. We all, and in professionals, we do that. And eventually, when you're in the health, eventually you're going to run across your colleague that's going to do, that will see you in a different way. So as long as you both remain professional about it, and that's fine. So talk about it. Bottom line, talk about it. Seek help. Understand that as you get older, things will change. Lifestyle will change. Family gatherings, family obligations, the stress level, the children becoming teenagers, the children becoming adults, your parents getting older, your job is changing, you're losing job, you're getting new jobs. All of that is so many things in life that you will have to do that's going to cause all the changes, and then your physiological changes where your testosterone level will drop. You go through changes where after you're having children, you may start feeling different about your body. If you ever had any kind of surgery, and some people say, okay, you have breast surgery, and oh, aren't you just happy you'd be alive? No, if you had a mastectomy, that's the reason now when people have breast cancer, they tell you go in with two, and you have to come back in. You're coming out with two. They're not leaving you with no breast and all. So even though you think you're happy because you don't have cancer now, but of course, you still want to feel like you said, still have the body parts that you went in with. So all of that with men, when you have prostate issues, some men don't want to do anything with a prostate cancer because they think it's going to leave them impotent. But there's so many advancements in different surgeries now that you don't have to be. And if it means for you to take some medication enhancing drugs and all to get to that point, and to help along the way, you'll do it because you're in a committed relationship, and you both understand each other. Okay. Again and again, if you're having relationship issues that have legitimate problems, seek help. Talk it over. Don't just talk to people who are going to be saying things that you want to hear. Make sure you have somebody who will be really objective. And if it means for you to go see a counselor, go ahead and see a counselor. Okay. But my most important thing, to make sure your heart and everything is okay. Keep your cholesterol under control. Keep your diabetes under control. If you're having problems sleeping, making sure you get enough sleep, making sure you check to make sure you don't have sleep apnea, because that can be very dangerous. Exercise 30 minutes a day, at least 3 days a week, and then just play. Have fun with your fun. Be playful again. Have the fun. Have the fun that you're supposed to have. Let me see what else. What are some of the causes of prostate cancer? I would do a show on prostate cancer later. Okay, I'm sorry about that. I'm gonna probably, since you brought that question up, I will talk about it. I'll talk about prostate cancer maybe in the next 2 weeks. So thanks for again doing that, because I get into a point I could talk more about that. Okay, so but it's important. And if you have your if you have prostate cancer in your family, chances are more you have a higher risk. Doesn't mean you're gonna get it, but you have a higher risk, so you have to be checking. Okay, so but do that and just be playful with each other. Rub lotion in each other, play with each other, go out for walks, have sweet talks, show off with your man, show off with your woman. When she walks in the room, look how sexy she is. Let her, when she walks in the room, you know how sometimes somebody walk in the room and you're like, look at her like that again, look at him like that again, and know that this is your man. When there's that TikTok thing where I say, this is your man, and you're gonna stick beside him, like, yeah, he's mine. I'm gonna stick beside him. I'm gonna stick beside him. Be like, like they always say, everybody put it on a woman man yet. I would take my own yacht. They don't want God give me. So do that and be happy, and I wish you all the best and healthy intimacy, sex life, or whatever it is. And I'll probably, talk about this every once in a while. I probably, when I bring up prostate cancer, I may bring up some issues on that too. But just leave some more questions and comments below. I just want to thank you all for watching, and thank you for tuning in. I really appreciate this series. And those on the Focus in Liberia, YouTube, and Facebook, thank you all so much. Please invite your friends to like and follow. I'm still trying to get to at least 1,000 followers by the end of August. I didn't reach my goal then. I won't be here on Friday. I will be posting regular stuff, but I won't be here on Friday because August 14th is our anniversary. I told you guys I started this program 2014, but I started Abby Tyler's Healthy Living page last year, but it's our anniversary. So I'll come on Sunday. But I do have a program to go to Friday. And plus it's summertime, so it's hard to get an audience on Fridays anyway, because everybody's getting ready for some wedding or baby shower or whatever's going on. There's so many things going on right now. So Friday's a hard time to get people. So when the weather gets a little cooler, when everybody's inside, I'll do that. But I will be back. I'll be back on Sunday. Also, and I'll be back with our show on next Tuesday. So our regular scheduled time show on Tuesday. Kids are going back to school, so I'll probably be talking about that also. So I have a couple of good shows that are coming on, including prostate cancer. So thanks for bringing that up. Okay, and I wish you all a good night. I know I talked too long. I didn't think I was going to talk this long. Once you get so into the intimacy, I can't believe my voice actually changed when I was talking about this. So you can see that, okay? Just be like, "Hi, honey, I just love you. Let me come here. Let me just, like that Prince song. Once you turn around, once you turn your big ass around, let me work in that zipper." Oh, I'm showing a different side of me today. But that's all about, making sure you're there and you're talking to your man and you're talking to your woman, and just be a communication. First thing first, it's almost communication, communication, communication. Okay. Thank you all so much for watching. All right. I appreciate it. Thank you for all your love and support over the years. You take care and good night and stay safe. All right. God bless. Good night.